how we're battling the life issue on multiple fronts. You thought, again, I think many people thought it was over, that Roe overturned. Hey, we're doing well. Not so. Obamacare, which is at the center of this government shutdown, is probably one of the strongest bastions of government-provided abortions that we see today. Joining me now to talk about this is Quena Gonzalez, who is the Senior Director of Government Affairs here at the Family Research Council. And he joined me earlier today up on Capitol Hill as we briefed senators on the issues related to the ACA. Quena, thanks for joining me.
Great to be here.
All right. So at the center of it, it's kind of interesting, quite frankly, that the Democrats have chosen to put the Affordable Care Act and its abortion funding, gender transition surgery providing measure at the center of the government shutdown.
It's almost like there's a spiritual dynamic to what's going on in Washington, Tony.
Yeah.
Yes. So what's at play, humanly speaking, on Capitol Hill? Democrats are demanding extensions of Affordable Care Act subsidies that were put in place originally to help people to afford health care under the Affordable Care Act, and then boosted majorly under COVID.
Because they couldn't afford affordable care.
And the truth is that America can't afford to keep subsidizing abortion
Right.
and gender transition procedures.
So this goes all the way back to the beginning. This is what I shared with senators today on Capitol Hill, is that, and I was here back in 2009, 2010 when Obamacare was adopted. It almost failed. It almost did not pass because of abortion.
That's right.
And it wasn't the Republicans. It was the Democrats, pro-life Democrats. We don't have those anymore. But they were opposed to it. So President Obama issued an executive order saying that, well, okay, Hyde will apply to this. Now, they already had a provision in here, Section 1301 or 3. Section 1303,
Yep.
which said, all right, there's going to be a separate dollar that's paid every month if you want abortion coverage.
Right.
Well, the Democrats knew that was a fraudulent gimmick. It wasn't going to keep the government out of the abortion business, so they said that's not good enough. So the president then issued that executive order, which later we found out was totally fraudulent,
Right.
false, did not stop abortion. The Government Accounting Office has followed up on this. They found that this so-called accounting scheme isn't even being put in place in most states.
In many states, it's not being followed, and there's really no accountability to the government on whether it is being followed. Unfortunately, we know one state that's following it, Maryland, just
Right.
passed a law. They're actually taking that dollar that people are paying extra every month for abortion coverage and setting it aside. And now they're going to use it to bring in people from out of state, from people from pro-life states who are seeking abortion. So if your state protects life, you can go to Maryland on Maryland's dollar.
Well, taxpayers' dollar.
Maryland
So
taxpayers'
what is
dollar.
happening is that states that have about 25 states that
Yes.
have laws protecting the unborn, and so abortion is illegal in that state, their tax dollars are funding the abortion in other states.
That's right. Living in a pro-life state does not insulate you as a taxpayer from underwriting abortion and gender transition procedures in other states.
Now, 15 years later, it's even worse.
Yes.
Because it's not just abortion that taxpayers are being forced to fund through Obamacare. It's also these gender transition procedures on minors.
That's right. As a matter of fact, the largest provider of Obamacare healthcare plans proclaims proudly on their website that the insurance company considers gender transition procedures necessary care that has to be covered by their insurance plans. And states like Colorado and California are using taxpayer dollars from all over the country to fund gender transition procedures in their states.
Now, the federal government under the Trump administration has said that gender transition procedures are not medically necessary.
Correct.
But that does not keep states from still spending their money that's allocated to them by the federal government on that.
What the executive order from President Trump said is that states are not required to require gender transition procedures, but that does nothing to keep states like
So
Colorado,
again,
California.
you have this division. You have half the states that are crazy and they're funding abortion and they're mutilating children, and you have the other half that's paying for it.
But it's exactly right. If you're living in a pro-life, pro-child state, you need to know that your taxpayers are underwriting this insanity.
Right. And that was the message we took to the senators today, and I think it got their attention.
I think based on the lively discussion that ensued, I would say you're right. I think this is a problem that a lot of pro-life, pro-family senators see.
So this, as there were some, as Senator Johnson made reference to earlier, that were kind of maybe leaning toward voting for this just to get the government back open, bad idea.
It's really important that they understand the pro-life, pro-child stakes in this battle. This is not just a matter of extending health care benefits that would make it more affordable for people. Leaving aside all the waste, fraud, and abuse that we addressed earlier in the program, there's a pro-life, pro-child stake in this battle.
We're back to where we started. It's a battle for life.
Amen.
Quena, thanks for joining me.
Great to be here.